Dr. Ranjit and Dr. Deepa ma'am for the excellent organization of so many activities under the umbrella of IAP Adolescent Health Academy. So, as the president of IAP Alappuzha, it's my responsibility to welcome. I welcome all of you, and let me welcome Dr. Ranjit P, the chairperson of Adolescent Health Academy, and I am taking this opportunity to welcome Dr. Deepa ma'am, also the vibrant secretary of IAP. Vibrant secretary of Adolescent Health Academy, Specialty Chapter IAP Kerala, and it's my privilege to welcome Dr. O. Jose, our dynamic state president, for leading us in an excellent manner throughout the year. And I'm taking the opportunity to congratulate Dr. Krishna Mohan and Dr. Ranjit, the treasurer of IAP Kerala, for the excellent organizing capacity, and they are leading us in an excellent manner. And I am also welcoming Dr. Shimi Paulos, the president-elect of IAP Kerala, the vibrant Shimi Chayan, the next president, Vijay Kumar sir, the immediate past president of IAP Kerala, our EB member Dr. Anil Vincent and Dr. M. N. Venkateswaran sir, and I also welcome Dr. Reshmi, the secretary of IAP Alappuzha. I also welcome Dr. Shaji sir, Ashok Kumar sir, Ashraf sir, today's chairperson, and I also welcome KK sir, today's well-known speaker and teacher. And without wasting much time, let's roll. And I thank IAP Kerala and Adolescent Health Academy for giving us an opportunity to host one of the webinar series of eminent subspecialty chapter IAP Adolescent Health Academy. Over to Dr. Shweta.
Thank you, sir. Now may I invite our brilliant chairperson of AHA Kerala, Dr. Ranjit P, for the presidential address.
Respected State President Jose sir, President-elect Dr. Shimi sir, immediate past President Dr. Vijay Kumar sir, today's speaker, my dear teacher, Dr. Krishna Kumar sir, my president of IAP Kozhikode when I was secretary of IAP Kozhikode, and my teacher, Dr. Ashraf TP sir, the EB member, and Dr. Anil Vincent sir, the EB members, the past AHA National Chairperson, Dr. Shaji sir, Ashok Kumar sir, and the vibrant team of AAP, Dr. Sri Prasad and Dr. Reshmi, and all dear seniors and dear friends. So AHA Kerala is coming with yet another Meet the Stalwart. We are now come with one of our stalwarts, Dr. Krishna Kumar sir. He is an eminent teacher and former director of IMHANS. So, and also the next week, IAP and AHA Kerala is planning to release a parenting module. That is a parenting week we are planning to conduct. We are planning to release 4 modules on substance abuse, how to parent an adolescent, and how a safe media usage and healthy lifestyle for adolescents. I request all the branches and all the dear friends to we will release the module in the next Monday and try to conduct maximum programs for the parents for the next week and make it a great success. So without wasting time, I extend my hearty thanks to the team AAP and IAP Kerala. Jai Hind, Jai AHA.
Thank you, sir. Now may I invite the President of IAP Kerala, Dr. Jose O. sir, to address the gathering.
Jose was here. One second, I'll just give her in.
Jose traveling ചിലപ്പം ലിങ്ക് ഇടയ്ക്ക് പോകുമെന്ന് പറഞ്ഞായിരുന്നു.
Let us proceed with the Shimi sir.
You can address, sir.
Can I proceed with the felicitations?
Yeah.
Okay. Now, in the absence of our respected President, Dr. Jose O. sir, may I invite for the felicitations Dr. Shimi Paulos sir, President-elect of IAP Kerala.
respected Chairman of AHA Kerala, Dr. Ranjit, the hosting branch, Alapura branch, Sri Prasad, and Secretary Reshma, the national EB members of IAP Kerala, and Secretary of AHA Kerala, Dr. Deepa, and our the speaker for today, Dr. Krishna Kumar sir, and all those who have joined us today in the Zoom platform. A warm evening to each and every one of you. I think so today Dr. Krishna Kumar will be highlighting on lonely teenagers. I think so more than the teenagers, even the parents as well as we are lonely now. We do not know what to do basically. So I think so giving us an insight, and especially I should congratulate the AHA team for bringing out good modules to, to increase our knowledge about it, and also making us a bit more confident when we deal with them. But it's quite tough when we deal with parents that I think so only the thing people who are very much interested in dealing with them can do it. But I think so we should all have it in the back of our minds. Teenagers are a very tough group to deal with, and I think so we really have to work hard, because as we see, the number of teenagers that are getting into trouble is also more. So definitely topics like this, especially I think so the topic that is coming up next week will be more useful for us when dealing to talk to the parents and giving them the confidence that they can get things done. So wishing all the best for the program and for all the work that has been done, and congratulating the team, AHA team, wishing all the team the best. Thank you.
Thank you, sir. Now may I invite respected immediate past president of IAP Kerala, Dr. Vijay Kumar sir, for the felicitations.
Respected Chairperson, Dr. Ranjit, and all my beloved members of AHA and IAP, and especially Dr. Krishna Kumar. AHA is coming out with excellent modules in the recent 1 or 2 years. And recently, I had an opportunity to review 4 modules that is about to be released by AHA. All 4 were excellent modules. And now today is a very, very important, interesting topic: the lonely adolescent, and that is being presented by none other than Dr. Krishna Kumar. And I think it is going to be a very informative session, and I wish the program all success. Jai Hind, JIAP, and JAHA. Thank you.
Thank you, sir. Now may I invite Dr. Anil Vincent, sir, National EB member of Central IAP, for the felicitations.
Good evening, all. Respected captains of the organizing brigade, Joe sir, Dr. Ranjit, and Dr. Sri Prasad, senior members of the association, and my dear friends. I am extremely happy to note that AHA is conducting this webinar in an exemplary manner. The brain and hands behind this, Dr. Ranjit and Dr. Deepa, deserve special appreciation. Having 2 teenagers at home, and after having attended so many CMEs and webinars like this, it is very difficult to manage them, as our dear Shimi has mentioned. In this era of electronic media, to manage their stubborn behavior as well as their peer relations, it is very Herculean task, actually. I am keenly waiting to hear Dr. Krishna Kumar, and I think after that I will improve myself. I am also happy to find my co-EB member, Ashok sir, as the chairperson of this webinar. I wish this webinar all the very best. I wish all of you a pleasant evening, a good academic feast, and as well as a delicious dinner at your own respective house. Thank you.
Thank you, sir. Now, Dr. Krishna Mohan sir and Dr. Venkateshwaran sir could not attend the meeting. So let us move on to the vote of thanks to be proposed by Dr. Reshmi, Secretary of IAP Alapura. Over to you, ma'am.
Good evening, all. On the behalf of IAP Alapura, I would like to express my sincere gratitude and thanks for the excellent and extensive session to be conducted by on topic adolescent parenting and media control, organized by IAP Kerala, AHA Kerala, along with IAP Alappuzha. I would also like to thank Professor Dr. Ashraf TP sir, HOD GMC Manjeri, and Professor Dr. Krishnamurthy sir, former enhance for sharing, about to share their valuable information and guidance on the same topic. And I would also like to thank Dr. Deepa ma'am, Secretary AHA, and I would also like to thank Dr. Josa in his absence, our dear State President IAP Alappuzha, Dr. Ranjit P. sir, Dr. Sri Prasad sir, Dr. Shimi Paulus ma'am, Shimi Paulus sir, Dr. Vijayuma sir, Dr. Anil sir, and Dr. Krishnamurthy sir and Venkateshwaran sir in their absence. Over to you, ma'am.
Thank you, ma'am. With this, we come to the end of the inaugural session. Now we move on to our academic session where everyone is eagerly waiting for our Professor Dr. Krishnamurthy sir's class to be chaired by Professor Dr. Ashraf sir. Now, may I invite the energetic chairperson, the energetic secretary of AHA Kerala, Dr. Deepa Janardhanan ma'am, to invite our chairperson as well as the speaker for the day.
Good evening, everyone. Actually, like Dr. Ranjit sir told, I'm also fortunate to be student of today's chair as well as the speaker. Both of them were my teachers. And I consider this as an honor to introduce to you the chairperson of today, Dr. Ashraf sir. Sir is the professor and HOD Department of Pediatrics, GMC Manjeri. He's also the consultant, Community Disability Management and Rehabilitation Project, University of Calicut. Sir is also holding the chairperson position of TB-Free Air Project of IAP Kerala. He's also currently the National EB member, Central IAP. He has held various offices in the past, like he was the chairperson of AHA Kerala, he was the past president of IAP Kozhikode. He was also the executive director, Kerala Social Security Mission during 2012 to 16. And it was during his tenure that the Shruti Tarangam project was implemented. He was also the founder, project director of State Initiative on Disabilities by Government of Kerala. Extremely happy to have you here, sir. Over to you, sir. Sure, sir.
Thank you, Dr. Deepa, for your nice words. Dr. Ranjit, the chairman, AHA Kerala, Dr. Jose, Dr. Shimmi, Dr. Vijay Kumar, Shaji sir, Ashok Kumar sir, Dr. Anil Vincent, Dr. Sri Prasad, and many other senior members are present in this platform. My dear friends, first of all, let me congratulate and thank the team, AHA, led by Ranjit and Deepa, for inviting me to chair this session and to introduce the topic as well as the speaker. I'm very happy to introduce my best friend, a person who is very close to my heart, Dr. Krishna Kumar, even though he doesn't need any introduction to any of the person present in this platform. He started his brilliant academic career as a lecturer of pediatrics in Trichy Medical College in 1998. Somewhere April or May, he joined the medical education service. After 5 or 6 months service in the Trichy Medical College, he transferred to Calicut Medical College. Being a child psychiatrist, he was the medical officer in charge of child guidance clinic at that time. And during 1999 or 2000, he started developmental clinic in IMCH, which was at that time inaugurated by the great personality MKC sir. And still I remember the talk given by the MKC sir after the inauguration of the developmental clinic under the Department of Pediatrics in IMCH Medical College, somewhere in 99 or 2000. Remembering that. Okay. Okay. Later, he was promoted as an assistant professor of pediatrics and posted in Alappuzha Medical College. I also, at that order, I also promoted as an assistant professor and posted in Alappuzha. But after a few days, government at that time, Srimati teacher was the health minister and Vishwas Mehta sir was the secretary. Being the handpicked Krishna Kumar for the post of director IMHANS. Even though IMHANS was established somewhere in 1997 or 1978 by the great professor of the Psychiatry, Dr. Shanta Kumar. It was after 78 means after 20, after 20, around 25, if even after 25 years, it was in the infantile stage. A small building in the mental hospital campus at Calicut was the, at Kudiravatam was the IMHANS. But Krishna Kumar nurtured IMHANS. Now the IMHANS is a state-of-art center in the field of disability. Both they are conducting courses as well as they are giving services to many children with disabilities. Now it is a state-of-art institute. And during the, I think it was during 2006, somewhere in October, November or December, Krishna was handpicked by the government for the post. After that, luckily, he got a central assistance of 20 crores something. That was the story of IMHANS. Now, IMHANS is a very good educational institution in the Kerala. And he published a lot of papers. I think he published among the Calicut faculty in our generation, he published more papers than any other one. Around 45 standard publications in standard or very good journals, indexed journals. I'm very happy to present this humble, great personality to you. And today's topic is very important. As Dr. Shimmy rightly pointed out, the loneliness is not a problem of adolescents only. It is a silent epidemic now. Many of us are also experiencing the loneliness because our children grow. When they completed the +2 course, they will go for the higher studies in many places in the country, even outside the country. Yet another is the nuclear family norm is a most acceptable norm nowadays in our social arena. So loneliness is a silent epidemic, I think. We are also trying to overcome it. But the adolescents, regarding the teenage loneliness, they may experience loneliness in the midst of the family. That is the difference, I think. So I once again present Dr. Krishna Kumar, an apt person to talk on the topic, the lonely teenager, to you. Over to you, Dr. Krishna Kumar.
Thank you, Dr. Ashraf. Am I audible?
You are audible.
Yes, sir.
Okay. So at the outset, I thank Dr. Deepa, Dr. Ranjit, the Adolescent Academy for both for inviting me for this talk and also for choosing this topic. In fact, usually most of the topics in adolescent psychiatry, I talk offhand, but for this lonely adolescent, I had to prepare something. I had to go back and read and prepare, because this is a topic which is usually ignored or do not give sufficient or do not get sufficient attention. So what I plan to do is a 20 to 30 minutes talk, and then we can have a discussion. Dr. Simmi, Dr. Sri Prasad, Dr. Shaji is there. So many senior people, Dr. Ashok Kumar is there. So because Newton has just come. So this is an area which I think we pediatricians need to discuss. We all know that man is a social animal. In the 4th century BC, Aristotle talked about this sentence: man by nature is a social animal. For the well-being of human being, for development, for psychological well-being, for overall development, social interaction is essential. And I have found that recently somebody has corrected this sentence as man is a social media animal rather than a social animal. Aristotle has also said that man is a political animal in his book, famous book called named Politics. So whether it is social animal or a social media animal, it indicates that man requires social interactions. Now, when we talk about loneliness, you can think of loneliness in different planes. Poets have talked about the feeling of loneliness, being alone. We mortals live alone. And there are a lot of philosophical aspects, different types of loneliness, like metaphysical loneliness, epistemological loneliness. They talk about different existential loneliness. So here, but I'm not going to those aspects. I'm talking about the real type of loneliness, or the which the adolescents feel in the real life. And during the COVID-19 pandemic, we all were aware of, much more aware of this loneliness. It was an enforced loneliness. And there were a lot of discussion on loneliness, social relationships, and mental health in adolescents, and what is the long-term impact of loneliness. In fact, they have conducted a systematic review the impact of social isolation and loneliness on mental health of children and adolescents in the context of COVID-19. So what they did was they collected data of loneliness during previous forced isolations like Ebola endemic or localized epidemics. And they studied the impact of that enforced loneliness on children and adolescents. And they found that even many years, sometimes 8 to 9 years after the forced isolation period, mental health problems can occur, like depression, predominantly depression, or social anxiety in boys, where they cannot go out, cannot interact properly with peers, that type of problems. More than 1/3 of adolescents during the COVID-19, more than 1/3 of adolescents reported high level of loneliness and social isolation. Now, what is loneliness actually? If you see the definition of loneliness, it is a painful feeling of sadness and emptiness. You become aware of an inconsistency between one's actual connections and the number of social connections one desires. But actually, so there is a discrepancy between what we have and what we expect. So it is an unpleasant experience from the perception of one's network of social relations lacking significantly in either in quantity or quality. So it's actually a perception. You may be interacting with many friends or colleagues, but still you can perceive or you can feel that you are lonely, you are alone. So it is subjective experience. One person may be having very few friends, but he may not feel lonely. The other person may be interacting with many people, many friends. Still he can feel lonely. That is one thing. And the other thing is loneliness is actually an everyday experience. We all feel lonely sometimes. That is not what I inverted comma say pathological loneliness. So when we talk about pathological or harmful loneliness, it is something which causes distress. Distress in the personal level or in the functional level. So the adolescent boy or girl feel lonely sometimes. We all as adolescents felt lonely. But if it is causing problems in your social life, in your academic life, then it becomes something which needs intervention. In psychiatry, that is a dictum. So any problem which is causing distress, then that needs intervention. Now, how prevalent is loneliness in adolescents? What they say is the feeling of loneliness is maximum or most common during adolescence compared to any age groups. So one study report more than 70% of adolescents experiencing recurrent loneliness. And the rate decreases as age advances to adulthood. And then again, when you become older, after 55 or 60, then again this feeling of loneliness occurs. We talk about emptiness syndrome, where the children are all leaving, the parents are alone, or during the COVID period, the husband or wife died, the partner is no more, feeling loneliness. And the other issue is number of, as I already mentioned, number of friends people have does not predict loneliness. You can have many friends, but still you can feel lonely. And there is no significant gender difference for loneliness in adolescence. There are studies which say that girls feel more lonely, whereas in adult studies, they report loneliness more in female. In children, adolescents, that gender difference is not there. And the other issue is there is worldwide increase in loneliness, as Dr. Sidney and Dr. C. Prasad, many of them were mentioning. The school loneliness in children increased from 2012 to 2018. They studied 37 countries, and in 36 out of 37 countries, it increased. Nearly twice as many adolescents in 2018 compared to 2012 had elevated school loneliness. And this increase was found to be, in this study, more among girls. And they found an association with smartphone access and internet use, that screen time and loneliness. But this is controversial because social media have it can have both a harmful effect and protective effect regarding loneliness. We'll come to that later. And why this loneliness is more, we said 75% of adolescents feel lonely. Why it is more during adolescence? Because we all know the adolescent brain is a work in progress. It is growing, and the new connections are forming. And this growing brain, the changes occurring in the brain are influenced by many factors, environmental factors, hormonal factors, and some occur as a consequence of pubertal growth. Some are independent of puberty, some precede pubertal development. So all these causes, so predisposes for a potential internal dysynchrony in the brain functioning. That is why Anna Freud, Sigmund Freud's daughter, has this statement: it's normal for an adolescent to behave in an inconsistent, unpredictable manner. Sometimes we may love parents, may hate them, extreme fluctuations. Now, this adolescent psychology actually predisposes to loneliness also. Just like other mental health issues, you see, the characteristics of adolescent psychology are mood swings. They can have lower mood and high mood. And depending upon the mood, their response can change. Low frustration tolerance. Now, this low self-esteem and poor self-concept, many studies have reported that there is an association between feeling of loneliness and this low self-esteem and poor self-concept. And the other one is the real or imagined worries about physical illnesses, about body shape or body concerns, and all this type of psychological issues can cause predisposed to loneliness. The Erickson's the adolescent period is the identity and identity diffusion. The adolescent boy or girl is trying to develop his own or her own identity, sexual identity, vocational identity, group identity, ideological identity. So all these things predisposes to the feeling that I am different. So I have no friend, or my wavelength of thinking is different from the other person's. And I'm lonely, I am alone, that type of thoughts. Now, they talked about adolescents. One study, in qualitative study, found that there are 3 types of loneliness can be identified among adolescents. One is social, where social interactions are limited, then emotional, then existential loneliness we talk about later. Now, the loneliness can be voluntary, involuntary. Voluntary loneliness, it is something which you seek. Indian philosophy, they talk about ekanta, in sense ekanta, where you can meditate, you can introspect, and you can get new ideas. Western, they talk about solitude. Thoreau, the famous writer, philosopher, almost 1 or 2 years he was isolated from the world. He was staying in his cottage called Walden, and he thought solitude is my best friend. And so that solitude is different from loneliness. So solitude is something which you use for introspection, rejuvenation, meditation, all those aspects. Social loneliness, these are certain comments from adolescents. When I start the first year of university in a new city, new school, and first time living alone in my entire life, so you feel that I have no friends, I am alone. Or they say there was a lot of free time, but what do you do if you have no friends? So many of our children, when they change school, this happens. There is no friend, you feel lonely, and sometimes this loneliness can lead to adjustment problems, adjustment disorder. But usually this type of feeling gradually disappear. And this also is there. Every adolescent thinks that this is my problem alone. My classmates adopt quickly to this new student life, but I'm not able to adjust. I don't think I have felt like a part of this group that I study with. So that type of thinking is common in adolescence. It's only my problem. The other person is much better. Other person is much better to adjust. So these type of loneliness they call as social loneliness, where because of the social environment is not congenial for interaction, and the boy or girl feel lonely. The other one is you got a lot of friends, but you cannot connect with them emotionally. And so I feel alone. Emotional loneliness could arise if one did not have friends. The friends, they don't understand me. That doesn't mean when it came a large group or a small group, but you will be smiling, you'll be shaking hand, you'll be friendly, but still in that crowd you will be lonely. That type of loneliness is emotional loneliness. And they found that this type of existential thoughts, feeling of being lost in life, what is the meaning of life, that also is very common in adolescents, especially children who read a lot of books. What is the meaning of life? What is the aim? Where am I going? What am I doing? That type of thinking. She neither belonged, I don't belong to this group. That type of existential loneliness, philosophical thing also can occur in adolescence. Now, studies have found certain predisposing factors. This feeling of loneliness, social interaction, all depend on your personality. You can be introvert, extrovert, different type of personalities. And personality is something connected to genetics. So maybe genetically നമ്മുടെ സ്വഭാവം എന്ന് പറയുന്ന പ്രകൃതി എന്നൊക്കെ പറയുന്ന കൺസെപ്റ്റ്, ഒരാളുടെ ബേസിക് പ്രകൃതി എന്ന് പറയുന്നത്. And the other factor is they found that lack of attachment with parents, disruptive families, disharmony among parents, death or separation of parents. So children coming from this type of problem families, there is more chance of loneliness. Then the low self-esteem, bullying is very common in our schools and colleges. So victim of bullying always feel this type of loneliness. And adolescent with physical illness, especially chronic illness, rheumatoid arthritis, epilepsy, this type of or mental health issues, there is more chance of feeling lonely. The exclusion from due to any cause, it can be racial, religious, regional thing. Suppose the boy or girl is going to an out of the state institution or out of the country institution. And extremes of functioning. A person who is very intelligent, like a genius, he may feel isolated. We cannot interact with the other students. Similarly, those functioning below average may also feel left out. Mental illness like social anxiety disorder, where because of the anxiety you are not able to interact with the others. Depression. And adolescents are concerned with social function, how the general attitude of the society, self-centered people, not interested in sharing, not interested in connecting with others. Social media influence, actually, it is a double-edged thing. Studies have shown that children, adolescents who spend more time for social media, there is a connection with the loneliness. But it is argued that people who are lonely, they use social media more. So the social media use is not the primary thing, but loneliness and the thing is the primary thing. Especially they don't want to go out during the online classes. We conducted a survey among adolescents, among teachers also. So some teachers said some children who function poorly in the school during the regular classes, they function very well during the online classes, because in the real life class they have to interact with others, which they are not able to do. But in the online setup, they are able to interact better. So that type of this thing is there. And the other thing is, even if you don't have any psychological issues, if you continuously use social media, Facebook or WhatsApp or other things, it becomes a habit. And in children, adolescents, this habit, there is a chance to develop into addiction or in the level of addiction. And once it becomes a habit, then you don't want to go out. You don't want to spend time with others because you want to go back to your Facebook friends or social media friends. So that can lead to loneliness. But some people argue that people who cannot connect in the real life, the social media connections maybe help them to cope with the stress. They have social media friends, they can interact with them. So that type of studies are there. So the social media influence is actually a lot of individual variations. So we can suggest a balanced, a middle way with the restrictions. That is UNICEF and all now say the social media use should be limited. The children, adolescents should find time, should be encouraged to do extra outdoor activities. That all time limit is not strictly enforced now. UNICEF and American Academy of Pediatrics and all for adolescents. Now, they found certain protective factors, parental warmth, healthy families is associated with a decreased level of loneliness. Similarly, school environment, the degree to which you would feel connected to the people at their school. IAP was talking about child-friendly school initiative previously. I think we should have a program which the Adolescent Academy can take up, with child and adolescent-friendly school initiative, because a healthy school environment has an important role to play in the mental health, psychological well-being of adolescents. Youth who are well linked and feel supported by their friends, they report less loneliness. Lonely adolescents feel less integrated and less attached to their school. Now, their team studied the immediate impact or the emotional components associated with the feeling of loneliness. They identified 5 themes. It's a Finnish study. Loneliness as an extreme dark experience. So these aspects may be associated with loneliness: frustration, anger, anxiety, you feel sad, you feel empty, hopeless, helpless, and experiencing suicidal thoughts, self-harm behavior can also there. And the loneliness can, somebody is exhausted by loneliness. You are not able to sleep properly. And difficulties with the peer relationship. And this peer relationship is a connection with, is associated with the conflicts in the family. And the school difficulty that can lead to academic difficulties. And all these can worsen loneliness. Your academic deterioration can lead to further problems. And in this study, they found that the coping strategies fail to alleviate loneliness. So what this sentence means is, for the adolescent, if you are doing something, this or counseling or whatever it is, it should be really effective. Then only they will continue the therapy, continue to attend the clinics and all. And what are the consequences of adolescent loneliness? The studies have found that loneliness is directly associated with poor mental and physical health during early adulthood. Not only during adolescence, but can persist to adulthood also. High rate of depression and anxiety in adulthood. Social withdrawal. suicide ideation attempts, and overall poor general health. Not only that, they found that adolescents who feel lonely, isolated, there is a chance of developing high blood pressure, metabolic syndrome, obesity, high cholesterol level, etc. Now, this is actually associated with depression also. Adolescent depression is associated with later development of high blood pressure, obesity, other metabolic derangements. And now coming to loneliness and mental illnesses. So this is important. Loneliness can be a manifestation of depression. And at the same time, loneliness can predispose to depression. So my mental health has made me lonely, and my loneliness has worsened my mental health. It becomes a vicious cycle. And the other issues, mental health issues to be considered when a boy or girl feel lonely is anxiety, especially social anxiety disorder. We had a child with OCD who cannot travel in the bus, who cannot interact with others. And this boy used to walk 4 or 5 kilometers to go to school because he doesn't like to be touched by classmates or passengers. So anxiety, social anxiety disorder. And psychosis rarely, because most of the time psychosis onset during the late adolescence period after teen years. If you the clinical approach to lonely adolescents is you should know that loneliness is not a complaint. No adolescent will come to you, or it is very rare that I feel lonely. Maybe they may go to the teacher and the teacher will say something. But for the clinician, usually they present with behavior issues. As we have already mentioned, irritability, anger, aggression, or academic deterioration, or relationship issues. And this loneliness we identify when we take the history. But what they say is tackling this loneliness, helping to cope with loneliness will go a long way in treating the child or in helping the child as such. So you look for detailed family history, school history, relationships, what is the world outlook of the child, and see what is the problem of loneliness and try to help to cope with that feeling. And this again, I'm not the person I pretend to be. I'm much different than the person I pretend to be. Most of the time, adolescents, they don't like to express this type of distress feelings. They may be smiling, they may be playing with others, but only when the other issues like academic deterioration or behavior changes come, we think of this aspect. Here, a 15-year-old girl, all these are features of depression. And this is important. A previously normal behavior, recently developing this type of problems. And loneliness may be a personality. So from the very younger age onwards, a child may be not interacting with others much. But a child previously interacting with others, previously having normal playing, normal playful activities and all, develop this type of withdrawal, aches and pains, irritability, anger. Then you think of a psychological problem, depression, all these things, crying without reason, depressed mode, all these are features of depression. So this feeling alone, not interested in going out, feeling alone, helpless. So here, this is a part of the depressive symptoms. Now here, it's a +1 student change in a school from the Silver Hills School. After +1, she joined our Chinmaya school in Tandayad, so that the school atmosphere is totally different. So feeling lonely, no friends. And here it is that social loneliness. And that results in then the parents, they want to go back to the old school and adjustment problems, they change the school. It's very common, I feel, because everyone becomes no friends. I don't belong to here. I don't know this type of feelings. So here it is not part of depression or psychological issue. Here it is social loneliness. Now, this is a very famous scale to assess loneliness, not for adolescents, but older adults also. UCLA loneliness scale, a 28-item scale, with 20 questions. You answer never, rarely, sometimes, always, and there is a scoring system. So, anybody interested in studying, doing research on loneliness, this scale can be used. So, I think I stop here and like to listen from the senior faculty. We can have a discussion. So once again, thank you for patient hearing. Thank you for inviting me and also for choosing this topic. Thank you.
Sir, any comments? It was an excellent session, Krishnamurthy sir. It was like, felt like being in a class. Learned a lot today.
Dr. Krishna
Thank you, Dr. Krishna for that excellent talk.
Dr. Krishna Kumar?
Okay.
Okay. Very interesting talk, Krishna Kumar. Very rare topic. And I came to listen, one, because it's a very unusual topic. I've never thought of such a topic. And secondly, because of a very authoritative speaker. It was very interesting to listen, something I've never thought about before. Now, one thing that I felt is that you may mention social media and the conflicting ideas about it. Now, even among social media, there are so many types of social media. My personal impression is that WhatsApp, if used sensibly, and most people do use it to some extent. I don't know about teenagers, adults also are excessively fond of WhatsApp. But if we use WhatsApp properly to keep connected to our old friends, to our schoolmates, and so on and so forth, I feel that WhatsApp specifically helps us to remain connected with other people and actually reduces loneliness. Whereas when it comes to things like Facebook and Instagram, I sometimes get the feeling that they are not social media, they are unsocial media. They create a spirit of competitiveness rather than closeness and friendship. So I feel we should differentiate between different types of social media. What say?
Okay. So actually, I think it's a valid point. Actually, somebody should conduct a study on the type of social media used by adolescents, how much time they spend, and the impact of each type of social media. I don't think anywhere there are studies like that. We think of social media as a single entity. And also there is actually a cultural aspect. So another world, a virtual world is coming up. And that virtual world is totally different from the real world. Their norms, the language they use. So everything is different. I think it is high time that philosophers or social scientists pay attention to this aspect.
Another thing that I felt was that we might be going in for an increase in loneliness, because what we are seeing is that it's a cultural difference. Now, in the West, and we are going in that direction, the Western culture, I mean, we have developing countries have always had a very dependent sort of culture. because of poverty, etc., etc. We have a dependent culture. We are always dependent upon our parents, dependent on these people, dependent on that. The Western culture has moved beyond that to an independent culture, which is what we want. We want all of us to be independent. Now, this independent culture has gone a little too far, I feel. It's gone to a state where everybody wants to be so fiercely independent, starting from adolescence, that they feel that even friendship is a restriction. I don't want to get married because I will be to some extent dependent on my wife. I don't want to have children because, again, it reduces my independence. I don't even want to have friends because I have lots of acquaintances. I have acquaintances at work. I have acquaintances on Facebook. I have acquaintances of different types. I have my badminton acquaintances. I have my shuttle acquaintances. Some are different types of acquaintances, but I don't want to have close friends. Everybody needs to have a few close friends. You know, one good wife, spouse is good enough, but you need a few close friends. But that feeling among those who go abroad, it seems like they are so fiercely into being independent that they forget the need. They don't realize the need to have a few good friends.
Can I
But
add?
we belong to the
Philosophy.
older generation. We are not connected to
Thank
the
you,
younger
Dr.
generation. That is-
Newton, for the comments. There is a question in the chat box, Krishna Kumar, whether the existential loneliness can be an
Okay,
early symptom of a psychosis.
okay, it's a very good question. Well, it is not a symptom of psychosis. You cannot say like that because these type of thoughts are very common. The existential thoughts, what is the meaning of life? All men are alone. That type of thoughts are very common during adolescence. There is a saying that adolescence, മലയാളത്തിൽ പറയുന്നു കവി എന്ന് പറയും ഒന്നുകിൽ യു ബിക്കം എ റെവല്യൂഷണറി ഓർ യു ബിക്കം എ സന്യാസി. ഉറൂബിന്റെ ഒരു ഫേമസ് ഇതുണ്ട്. ഐദർ യു ഒന്നുകിൽ നിങ്ങൾ സന്യാസിയാവുന്നു, അല്ലെങ്കിൽ വിപ്ലവകാരിയാകുന്നു, അല്ലെങ്കിൽ നിങ്ങൾ പ്രേമിക്കുന്നു. ഈ മൂന്ന് കാര്യമാണ് അഡോളസൻസിന്റെ ഇതായിട്ട് വളരെ മുമ്പ് ഉറൂബ് എഴുതിയതുണ്ട്. അപ്പൊ അതിന്റെ ഒരു ഇതെന്ന് പറയുന്നത് ദീസ് ടൈപ്പ് ഓഫ് സ്യൂഡോ ഫിലോസോഫിക്കൽ ഐഡിയാസ് പറയും. ദാറ്റ് ഇസ് വെരി കോമൺ ഡ്യൂരിങ് അഡോളസൻസ്. It can be normal, but it can be a manifestation of psychosis very rarely, because people with psychosis can have this type of pseudo-philosophical, pseudo-scientific ideas. But this is very common, this type of loneliness.
Okay, Krishna. കാരണം എന്ന് പറഞ്ഞാല് ഏകദേശം നമ്മളൊക്കെ ഇങ്ങനെ പലതും ആലോചിച്ചിട്ടുണ്ടാകാം ആ പ്രായത്തില് അല്ലെ. As the days goes, that thoughts gets vanished. So if it is a persistent thoughts, it may be a symptom of.
No, sir, actually, how do we deal with them? Like if a person is experiencing this loneliness in adolescent, how do we help them out finally?
Clear ആയില്ല.
Sir, if an adolescent is experiencing pathological loneliness, how do we help them out actually? Like, how do we deal with them?
How will you identify now?
No, how do we help them? How do we treat them?
How to treat them?
We can't cure, I know, but then like how can we help them cope?
And actually, that is why loneliness is a part of a symptom usually. So you identify the basic cause. For example, Shubha, the madam actually, distress would be the clue. So distress can be an indication that it needs intervention. We don't use the term like normal, abnormal. If the child or adolescent is feeling distress, that means that needs intervention. So you are lonely. I may be lonely. I may like to be alone. That's what called solitude. I like to be alone with a book, reading something. So it doesn't mean that that is not loneliness. That's not causing any distress. So if it is causing distress to me or to somebody who interact with me, my parents or classmates, then it becomes something which needs intervention. So we are not treating loneliness as such. So identify what is the problem and try to treat it. And if a boy or girl comes to you that I feel lonely, then that is what you talk about, discuss the family issues, school issues, and see what is the problem. And if it is a personality and all, you reassure the child that it is nothing, it is part of adolescence. I think most of the time, if you talk about the adolescent psychology, children will understand it. And what I usually say is most of this type of feelings will disappear when the brain becomes mature.
Okay. Shaji
A
sir?
lot of it is what we call loneliness. If somebody says, I am lonely, a lot of when a person says, I am distressed, I am always lonely, or I am distressed, I am always feeling bored. This distressing loneliness and excessive boredom are both actually frequently indirect, what do you call it, hidden manifestations of depression if we go into them deeply. What do you say, Krishnamar?
It can be a depression or dysthymia. Dysthymia is an entity where you have depressive feelings for a prolonged period. So 1 year, more than 1 year, you are having this type of feelings. You are down, you feel alone. So that can be a manifestation of dysthymia or depression. But this loneliness alone is not the diagnostic criteria. So it be associated to other symptoms.
Mr. Kumar, whether we can wind up the session. Dr. Shaji sir and Ashok Kumar sir is there. Any comments, sir?
Yes, Dr. Krishnamar. That was an excellent talk. I think all of us appreciated that. Loneliness, as you said, is a state of mind. You may be in a large group, as you mentioned, and still feel lonely. For example, an introvert with just one friend, he may be quite happy with that one friend and he could never be lonely. Whereas an extrovert with a lot of friends, he may still be lonely in spite of all his friends. So basically, it's a state of mind. I think the social media, maybe I belong to the older generation, so that I'm not in tune with the social media. Newton was saying about WhatsApp. I think WhatsApp is a big, what do you call, as my wife says, there's a devil in it, because you spend a lot of time on it. Ultimately, you gain nothing because everybody is competing to forward the same thing. That's what I feel. I don't look into WhatsApp except when somebody asks me to look into it, because I get about more than 500 messages per day through WhatsApp, which I have to stop my work and then spend my whole time doing in that. And then it is only, what do you call, you are still lonely because you're forwarding something, somebody else is forwarding you something. So it's a question of a cycle, whatever it is, whether it's Facebook or Instagram, all those things, I think people are still lonely with them. Maybe, I mean, an older generation, a person like me, I don't think that takes off the loneliness by going into it. I'm fine otherwise. But then the adolescents have a problem. So I think, as Krishnamar said, this is something which requires a serious study on the use. Instead of just saying that, decrying it and saying these are all humbug, but we got to accept that they are in, and we got to accept that the future generation is going to be with them. So that is something which we got to look into. Anyway, thank you, Krishnamar. That is a wonderful talk. Thank you very much.
Thank you. I think I have one more comment. Shaji sir, as Shaji sir said, most of the studies on social media, screen time and all from Western data, USA or UK or other European data. We don't have our data on, because there is cultural differences. The social media content is different. Our accessibility, these things are different. So any comment on social media, we need to develop our own data.
Okay, Ashok Kumar sir. Any other comments from anybody else?
Shubha ma'am, any comments, ma'am?
Yeah. Deepa, what did you say? You're not very clear.
Shubha Badavi ma'am is there, sir. She's
Yeah,
editor
yeah.
adolescent today.
Yeah, welcome, madam.
I think she's on there.
I think
Right.
if there is no further comments, we will wind up the session. Over to Deepa to.
Before that, I think
concluding-
I really
yeah, yeah.
I want to
Yeah.
congratulate Dr. Ranjit and Deepa for the excellent way they are doing things. Of course,
Yeah.
Krishna's
Definitely,
talk
sir.
is well appreciated, but then this is something which they are really doing.
Really appreciable, sir. Okay, sir. Then over to Deepa for concluding remarks.
I would like to express my wholehearted thanks to Krishna Master for the wonderful session and for Ashra sir for chairing the session so actively, and for expert comments from Newton sir, Shaji sir, Shubha ma'am was she was starting, and everybody here, Anil Vincent sir, Ranjit sir for all the support is given throughout, and Sri Prasad sir and his team from IAP Kerala. Thank you all. Have a good
Thank
night.
you. Good night.
Good evening.
Good
to all.
night.
And good night.
Good night.
Thank you, Dr. Sheda, for moderating the session so well.
Yeah, definitely. Shweta. Thank you, Shweta.
Thank you, sir. Thank you, ma'am.
Okay, thank you all.
Thanks.